You love your pet and you love your baby, but how do you keep them both safe at the same time? Because some common flea and tick sprays have been directly linked to an increased risk of pediatric brain tumors. What many parents don't know is that some of the oldest flea-killing chemicals were derived from nerve gas agents. Poison control centers receive thousands of calls for pet medication exposure, with nearly 90% involving kids under 5. Next, we'll reveal the chemicals, how they spread, and the vet-backed guide to keep your entire family safe. Children are uniquely vulnerable because their developing bodies are more susceptible to toxins, and they constantly put hands in their mouths. These toxic pesticides don't just disappear after you apply them. The residue can remain active on your pet's fur for weeks. That chemical residue transfers from your pet's fur to your child's hands, then spreads to furniture, toys, and into their system. A common mistake is letting a child touch a pet too soon after a topical treatment, creating a direct path for high-dose exposure. So we understand the pathway of exposure, but what exactly are these chemicals, and what damage can they actually do? Organophosphates and carbamates, from nerve gas research, work by disrupting nerve signals in insects and, dangerously, in humans. A common ingredient in popular flea collars, TCVP, has been linked to irreversible harm to a child's brain development. Other chemicals in liquid treatments, fipronil and imidacloprid, have been implicated in lower cognitive scores in some children. Beyond that, some popular collars have been found to contain high levels of PFAS, forever chemicals that accumulate in the body. With all these different chemicals, which over-the-counter products pose the biggest risks? You're about to see exactly what to avoid. The answer is that many common over-the-counter flea collars are a primary concern, representing a source of continuous chemical exposure. These collars function by constantly emitting pesticide gas and powders. This chemical dust settles on your pet, your furniture, and your child. Recall TCVP, the neurotoxin linked to brain development harm. It's a key ingredient in some of the most widely sold flea collars. Many store-bought topical drops also contain problematic pesticides and may be less effective, tempting parents to reapply them too soon. And this threat can start even before birth. Prenatal exposure to TCVP can lead to cognitive deficits, including memory and IQ deficits. Many parents turn to natural options, but herbal sprays can be ineffective, while substances like borax can be hazardous if ingested by a child. Even with safer products, accidental ingestion is a major risk. All pet medications must be stored securely and locked away from children. The amount of information can feel overwhelming, but there is a clear, vet-approved path forward. Let's build your family's safety protocol. So we've established that the primary danger comes from toxic residue left on your pet's fur, containing neurotoxins like TCVP. If the problem is chemical residue on the fur, the most direct and effective solution is one that eliminates that residue entirely. This is why oral flea medications, like pills or chews, are a veterinarian's preferred choice for households with young children. Oral medications work from the inside out, leaving no chemical residue on the pet's coat, which removes the primary pathway of exposure. Action Step 1. Your veterinarian is your most vital partner. Do not buy over-the-counter products without their specific guidance. Action Step 2. Ask for oral medication first. This is the single biggest step you can take to reduce your child's chemical exposure. Action Step 3. If you have to use topicals, enforce a strict quarantine of 24 to 48 hours until the application site is 100% dry. Action Step 4. Avoid high-risk products completely. As a rule, do not use flea collars containing TCVP or other organophosphates. Action Step 5. Control your home environment. Vacuum all floors and furniture frequently and wash pet bedding weekly in hot water. Action Step 6. Lock everything up. Store all pet medications in a locked cabinet, completely out of sight and reach of children. Flea prevention isn't just pest control. It's about actively safeguarding your family's health. This protocol from Flea Tick Fix lets you do both effectively. Take this knowledge to your next vet appointment. Ask the right questions. You are your child's most powerful and informed advocate.